Mental Illness Treatment Strategy by Venerable Rung Ruong Popas Saro, Dr. Rung Ruong Lim Chupatipa. Life is a stream of consciousness. A developed mind is such a mind that can perform the basic functions of consciousness rightly. That is, having mindfulness to be aware of the object of consciousness, having concentration to focus on the object of consciousness rightly, and finally having wisdom of the knowledge of the truth of life, so that the mind will be able to respond to the object of consciousness rightly. The three factors of mindfulness, concentration, and wisdom are basic quality of consciousness that will enable the mind to proceed the mind processing rightly. And no matter of what kind of a stimulus may be, in the process of dependent origination, the mind will maneuver the life in the right way, and making an end to suffering in life. There are three kinds of treatment strategies as follows. 1. Modern medical treatment approach, balancing the mind conditions by drug. That is, by having knowledge that a certain mind condition is caused and associated with a specific neurotransmitter, therefore in case of lacking or overwhelming by such a neurotransmitter, then that a drug to compensate it. In addition to the medical treatment, several non-drug treatments like experimental and small group learning, daily meditations, yoga and mindful movement, and periods of silence are included in modern medical treatment. 2. Mantra meditation approach, balancing the mind conditions by force. That is, when the mind is thinking around on something, then by reciting with short sacred word, the mind focuses on such a short word, and then the mind will become concentrated. This technique seems to be a direct treatment, especially for the symptom of attention deficit. However, this technique has a drawback when trying to push the mind by force, and some cases when applying to children whose mind are very active in learning around. In 2022, there was a research study testing more than 8,000 children across 84 schools in UK from 2016 to 2018, $8 million fund. The study referred to the type of mantra meditation called the Dharmatrata meditation of 1,500 years old. The mantra-based meditation technique was performed by reciting short Dharma word during the meditation, forcing the mind to be concentrated on a sacred word, and the results showed that this technique failed to improve the mental well-being of children compared to a control group. This kind of meditation in that study is typically a derivative of mantra meditation, of which the Buddha explained in Oriya Pariyasana Sutta as follows.
As far as mere lip reciting and rehearsal of Dharma, this method does not lead to disenchantment, to dispassion, to cessation, to peace, to direct knowledge, to enlightenment, to nibbana.
3. Mindfulness meditation approach, balancing the mind conditions by wisdom. By realizing the cause of mental illness is due to the lack of mindfulness. Therefore, the focus to resolve the mental illness is to learn on how to establish mindfulness to monitor the mind conditions first, so that whenever there is any dysfunction of unwholesome within the mind processing, then we will take a necessary action to contain and to abandon it. That is, when the mind is unwholesome, then establishing mindfulness to bring in with proper Dharma, knowledge developed from insight observation, to abandon such unwholesomeness, and then the mind will become internally steadied, composed, unified, and concentrated. This type of meditation was first introduced by the Buddha several thousand years ago. The Buddha suggests to make use of mindfulness to abandon any arising unwholesome thought, so that the mind will become internally steadied, composed, unified, and concentrated, and then to perform insight observation to study on what the mind is and how it functions. This introspective learning is the part of cognition development, so-called Dharma, and then establish mindfulness to be accompanied with the Dharma to destruct all kinds of defilements by wisdom. In principle, we can combine all the three strategies together to enhance the effectiveness of the treatment. It should be noted that all kinds of mindfulness-based cognitive therapies are originated from the Buddhism as recorded in many Buddhist sutras, for which the Buddha had introduced more than 2,000 years ago. In one conversation between the Holy Dalai Lama, Aaron Beck, who is regarded as the father of cognitive therapy, CT, and cognitive behavioral therapy, CBT, they both concluded that in fact the Buddha was the first one who discovered this technique.